Good morning. So today I will be talking to you on a very important topic which has a lot of relevance to not only the eye but also on a very large systemic perspective. So the topic for today is uveitis, which is essentially an inflammation of the uveal tract. Now I have divided the topic into anterior, intermediate and posterior types because one has to examine and diagnose conditions pertinent to the different anatomical classifications. So, why are we even discussing this topic? What is the importance of uveitis? Like I just mentioned, it is most frequently associated with systemic diseases, and these systemic diseases can be an infection, it can be an autoimmune disease, or it can be an idiopathic nature of the disease. So, any systemic disease can have ocular inflammation, and this ocular inflammation most commonly manifests as anterior uveitis. It can often affect younger age groups. That is the bane of the disease because it is very important to diagnose ocular inflammation at the early stages in these younger age groups, as it can result in complications and thus have a bearing on their social and economic life. It is a highly recurrent disease, so even after the treatment of the preliminary attack, we need to keep the patient on follow-up. And it is also important to note that with each recurrence, the chances of complications and hence the chances of visual loss in these patients becomes higher. Again, visual loss can occur both during the active and heal stages, and hence it is not adequate if we just treat the patients once. We need to watch them even if the disease has become inactive, because they can have complications which develop in the heal stages such as membranes and edema which can block vision. It is extremely important to obtain a good history, a good systemic and ocular history with lot of importance given to the treatment of these patients in the past. A good physical examination is performed in liaison with general medicine department, or you can also do it with an infectious disease specialist based on the suspicion that one may have on the ocular features. A medical opinion is obtained not only during the initial visit but during all follow-up visits to see if there is a progress or improvement of the systemic disease, and also to check if the patient has any side effects of the systemic medication that we may be administering. Of course, the ocular examination is the important part of, it's very integral to diagnosis of uveitis, which I'll be coming to eventually, and investigations is the key. The ocular diseases per se can be diagnosed with a good ophthalmic examination. However, since we're dealing with uveitis, which is based on inflammation, we would like to identify the structure that is involved, and hence an elaborate systemic investigation may be required in these patients. So this is the picture to show you the anatomical continuity of the uveal tract. So this is the iris, the ciliary body, which is this comma-shaped enlarged bulbous structure, and the outlined red area which is running behind the globe is the choroid. So as you can see, there is a continuum of the entire uvea, and hence we call it a uveal tract. So this also goes to say that an inflammation that occurs in the anterior most of the iris has a propensity to spread through the entire uveal tract and can reach the edge of the choroid as well in the posterior most aspect. So what is it that makes it so important? The iris is a diaphanous structure. The iris is the anterior most part. This is what we see in all our patients and in each other. The brownish area which has these undulations are called scripts. So these scripts can be divided. This area of the iris is the visible part when you're observing anybody from the front. So this iris can be divided into two zones. The posterior part is called the ciliary zone, and the anterior part is called the pupillary zone. So the junction between the two is the collarette. It is very important to know that the iris has two segments, pupillary zone and the ciliary zone, because The pupillary zone and ciliary zone also contain two very important muscles, the sphincter pupillae of the iris and the dilator pupillae of the iris. Then the ciliary body, which is believed to be a triangular structure, and this ciliary body has what you call ciliary processes. The importance of the ciliary body is that it performs two very integral functions of the eye. Firstly, it secretes aqueous humor, and secondly, you also have the ciliary body participating in this process which is called accommodation. In other words, your ciliary body is important to regulate the intraocular pressure, and it is also important to perform accommodation, which in turn is the reason why we are able to adjust our vision to distant objects and near objects, because the process of accommodation is taking place. The third structure, which is the choroid, as you can see, it's continuing from the ciliary body right behind onto the posterior most aspect and terminates here at the optic nerve. This is the optic nerve. So this choroid is very important because it is the most vascular structure of the eye. So if you can go back to the previous slide where I mentioned that systemic diseases are common, this is the reason why systemic diseases are common. The choroid is a very vascular structure, and hence all the blood vessels are in communication with the choroidal vasculature, and infections and antibodies can travel, antigens can travel very easily into the choroid and hence set up an inflammation in the eye. Now, as you can see, the iris is in very close approximation with the lens. The ciliary body is connected to the zonules. These are the zonules. The zonules are also called suspensory ligaments, and they hold the lens in position. The choroid is the central portion of the three coats of the eye. The outermost is the sclera. The sclera is what we see in each other as the whitish, dense, collagenous coat, the outer protective coat of the eye. The innermost, the blue line that you're seeing, is the retina. This retina is the light sensitive layer, and it is extremely important for us to have a good functioning retina for it to enable good vision in each patient. Now, in between both the sclera and the retina is the choroid. So, just to recall, the sclera is a white, dense, collagenous, protective coat of the eye. The retina is the innermost light sensitive layer, which is important because it performs the function of perception of light and production of an image. And you also have the choroid. Choroid is the vascular coat of the eye, which is in continuum with the anterior part of the uveal tract. Now, I have just put this picture here for you to show you the normal optic disc. So, this is what this area is what you're seeing here.